Hello, welcome to Nurses Care YouTube channel. Today we will be discussing some of the previous questions from JIPMER Nursing Officer examination. So the first question, abnormal copper accumulation is seen in which of the following disease? So the options are Wilson's disease, Parkinson's disease, Sjogren's disease and hemochromatosis. So these are the options. We can see each option in detail. First is Wilson's disease. It is an inherited disorder that causes too much of copper to accumulate in the organs. So our question was abnormal copper accumulation. So this is the correct answer. Then it is an inherited disorder in which there will be lots of copper which will be accumulated in the patient organs. So it is considered as an autosomal recessive disorder. So it is the assumption or the hypothetical view that it is mainly caused by the mutation in the Wilson disease protein gene that is otherwise called as ATP7B. That is the gene responsible for causing this disease. So the occurrence or incidence is very, very rare and it can be estimated as one case in 30,000 people. So that will be the feature of Wilson's disease. Then next option was Parkinson's disease. It is a brain disorder that causes unintended or uncontrollable movements. We know that if the patient is having Parkinson's disease, they will be having tremor-like features and they will be having an appearance like stoop posture. Back rigidity will be there. Always there will be having some tremors in the hands. Okay, so the entire pattern of movement or the patient's appearance will be different in case of Parkinson's disease. So patient will be having some difficulty to move and also they will be having some difficulty to coordinate with the activity. So our next option was Sjogren's syndrome or Sjogren's disease. It is also an autoimmune disease. Mainly it will be affecting our body's moisture producing glands, especially tear glands, otherwise called as lacrimal gland, then salivary glands. We know that salivary glands will be producing saliva, then lacrimal glands will be producing tear. So it can also affect glands in the stomach, pancreas, and intestine. The disease causes dry eyes and mouth. It mainly affecting our moisture producing glands. So the main features of this disease will be dryness in the eyes as well as in the mouth. If the patient is having some disease in the complicated stage, patient will be having severe extreme cases of dryness in entire aspect of the body like skin, vagina, then nose, every aspect will be having a feature of severe dryness. We can't say or we can't identify any specific reason for this Sjogren's syndrome. So the cause is unclear or idiopathic in nature. When comparing with that of males, females will be affecting 10 times than that of males. So this is some of the pictures of patient who is infected with or who is affected with Sjogren's syndrome or Sjogren's disease. You can see that there will be some patches. It is mainly due to the severe dryness. Okay, especially in the eyes we can see a dryness and also in the tongues also we can see an extreme form of dryness. Our last option was hemochromatosis. It is a condition in which the body takes up and stores more iron than it needs. So hemochromatosis is something related to the accumulation of iron. We know that hemoglobin, okay, also something related to iron. The extra iron is stored in the liver, heart, and pancreas, which may cause liver disease. So, the patient is diagnosed with hemochromatosis, they will be having liver failure. So, the management for hemochromatosis will be liver transplantation in the end stage of this condition. Suppose if the patient is having storage of extra iron in the patient's heart, they will be having some problem with uh, conduction or problem with the pumping of blood. Then it will be affected with modes, multiple organ dysfunction syndrome and cancer. So there will be some kind of complication that we can see with the hemochromatosis. So the main condition or the main key feature associated with hemochromatosis is excessive storage of iron. Okay, so our question was abnormal copper accumulation. So we know that copper accumulation is mainly seen in case of Wilson's disease. So our correct option is option A. Hemochromatosis is mainly due to the accumulation of iron. So we can move on to the next question. All of the following are the signs of respiratory acidosis except. So the key point is except. Our options are headache, blurred vision, confusion, and high alertness. So we should know what is respiratory acidosis. Respiratory acidosis, it occurs when the lungs can't remove enough of the carbon dioxide that the body produces. We know that we will be having CO2 and O2 level. If the patient is having some difficulty for breathing, there will be accumulation of carbon dioxide. So it can be leading to carbonic acid accumulation. So that condition is called as respiratory acidosis. Okay, so pH will be low, then CO2 will be high. So if the patient is having some problem with the breathing, there will be increased accumulation of CO2. Then due to the increased accumulation of CO2, O2 level will be decreased. So patient will be having features like rapid shallow respiration, vasodilation. So the patient's PP will be reduced. Dyspnea will be there, headache. So our option was headache. Then hyperkalemia, dysrhythmia will be there, drowsiness and disorientation. If the patient is having diseases or if the patient is having an increased accumulation of CO2, they won't be alert and they won't be oriented. So patient will be having disorientation. So our option was high alertness. That is not seen in case of respiratory acidosis. Headache will be there, blurred vision will be there, confusion will be there. High alert patient may not be alert in case of severe respiratory acidosis. Okay, so the option D was the correct answer. Next question. A patient is scheduled for an elective surgery. All of the listed are important nursing responsibilities one day before the surgery. So the keyword in this question is one day before the surgery. Except. So which are the responsibilities of the nurse just prior to a surgery or just one day before the surgery? Option is patient education, obtaining consent, PAC checkup, and rehabilitation planning. So, which is the option is not concerned with the pre-operative preparation of patient. We know that before going to perform any surgeries, we should give a proper education to the patient regarding the exercises that they can be done after the surgery is done. And regarding the OT setup, the patient has to know about the OT setup or the location of the OT, the time period of the surgery, everything the patient should know. So these instructions has to be explained to the patient just prior to the surgery to get a cooperation from the patient. We know that obtaining consent, it is a legal procedure for performing any form of surgical interventions on the patient's body. So we should get an informed consent. So the informed consent will be taken by the doctor. It has to be taken only after explaining the proper instructions along with the complications of the surgery. Then PAC checkup, that is pre-anesthesia or pre-anesthetic checkup for the patient. So the anesthetist will be examining the patient and they will be assessing for any allergic histories to the patient and the patient's general condition. They will be assessing the site of or the type of surgery they are going to perform. So in detail, they will be collecting any form of allergy or any form of respiratory difficulties or CAD or respiratory difficulties, everything they will be evaluating with the patient's history. In this aspect, we can't see a rehabilitation plan just prior to the surgery. Actually, these plans can be happening once the surgery is over or just completing the surgery. We will be planning to improve the patient's functional ability. For that, we can be planned rehabilitation. Rehabilitation describes a systematic process of identifying the body's dysfunction, developing a plan of action to fix the dysfunction, and implementing an integrated corrective surgery or strategy in order to create more efficient movement, stabilize posture, and reduce pain. We know that if the patient is having any ortho surgery, for example, knee replacement surgery, patient will be having difficulty to walk, isn't it? So once surgery is over, in the post-operative day, they will be planning to improve the functioning of the lower extremities. For that, we will be training the patient, okay, to control we will be giving some kind of minute exercises to the patient. We will be supporting the patient mentally and as well as physically to improve their ability to cope up with the day-to-day activities life. So rehabilitation plan, it cannot be seen in case you just prior to a surgery. So this is the option. So this is the option. Rehabilitation planning is cannot be seen in case of one day before the study. That is not the necessary priority, necessary responsibility. So this is the correct answer for this question. Then next is in terms of response to fire accidents in hospitals, what is RACE stands for? That is a mnemonic, or that is a short form which can be used for managing fire accidents in the hospital. Options are rescue alarm control exit, rescue alarm contain extinguish, rescue alert control exit, and rescue alert control extinguish. We can see what is RACE. We know that in a hospital we can expect a fire accident at any point of time. If suppose any fire accidents happen, we will be starting with rescue. If the patient is having some difficulty to move out, we should analyze the patient condition and we should help the patient to move out from the dangerous situations at the earliest. Then alarm, we should activate the alarm for reminding others regarding this hazard, or else we can start with code red. Code red is mainly responsible for fire. Then next is confine the fire as much as possible by closing the doors and windows behind you during the evacuation. That is another measures that we can take during the fire hazard. Then last is extinguish. Only attempt to put out the fire if it is small. We can move or we can start fire extinguisher. So these are the management for dealing with fire hazards in a hospital. So our correct option was rescue, alarm, contain, and extinguish. So option B is the correct answer. Then next is 31st National Road Safety Week was observed. So we should know the number of week, or this is regarding the 31st National Road Safety Week. Options are 4 to 10 January 2020, 11 to 17 January 20, 3rd to 9th February, and 10 to 16th February. So what is a road safety week? A road safety week is celebrated from January 11 to January 17th in every year. It is mainly celebrated or organized by the Minister of Road Transport and Highways, mainly to spread awareness on the importance of road safety, to reduce the risk of accidents, to give awareness to the people. They will be celebrating Road Safety Week. So we know that if the accidents cases are increasing, the government will be taking some actions to reduce the incidence of this road traffic accidents. So the main purpose of this week is to spread awareness on the importance of road safety, which is a major health concern for authorities and the government. So our questions was regarding 31st National Road Safety Week, which was celebrated in the year 2020 from 11 to 17 January. So every 11 to 17 January, we'll be celebrating Road Safety Week. There will be a theme for every Road Safety Week. For 31st National Road Safety Week, there was one theme, that is bringing change through the youth power. They will be giving some awareness to the especially youth. Then the theme of 33rd. So 33rd Road Safety Week was celebrated in the year 2022. The theme was Sadak Suraksha Jeevan Raksha. That is the theme of 33rd Road Safety Week, which was celebrated in the year 2022. Suppose if our question was National Road Safety Day, the option or the correct answer will be 4th March. So it was celebrated from the year 1972. So that is the Road Safety Week and the date of Road Safety Week. So our option was 11 to 17th January 2020 is the correct option for 31st National Road Safety Week. Suppose if our question was 33rd, the year will be 2022. So that's all about today's session. So in this session, we have seen regarding 5 questions from the JIPMER Nursing Officer examination. I hope you got an idea regarding these 5 questions and their option in detail. Thank you for watching.